Dr. Bondarev, lots of people have knee problem, whether they call it meniscus, whether they call it whatever they call it, be it, people who used to do some sports in the younger days and then basically ruin their knees, or it looks like if you live long enough, you get a knee problem. And is there anything a person like you can do for it?
Absolutely. The most common problem with the knee is so-called meniscus. Meniscal problems constitute, I don't have a statistic, but majority of knee troubles, I apologize, that's meniscal problems. In all fairness, meniscal problems do not respond as well to manual therapy as, let's say, shoulder. But again, what options patient has? If there is a meniscal problem at the early stages, or let's say second, third grade of the tear, it's still repairable. You can't imagine how magnificent the restoration power of the body is. And if surgical intervention is practiced, let's say at the second or third stage of meniscal tear, it means pretty much that you remove this meniscus and you remove something that was given you by God, and there are no extra parts in our body, and there are no unnecessary parts in our body. So meniscus is definitely something very much needed. If you remove it little by little, there is a deterioration of the joint starts, and you end up with a pretty bad situation, with a significant arthrosis and deformation of the joint. Again, manual therapy does repair it. As I said, the outcome is not as dramatically good as with other parts of the body, but we're still able to restore normal circulation of the blood. There is no blood in a joint itself. It would be a huge trouble. But if we improve circulation in surrounding tissues and we improve normal mobility of the joint, body does restore the proper functioning of the joint, and there is a proper nutrition of the joint, and we see a lot of positive results, better or worse, but the majority of the results positive.
Got it. Can a person, if he undergoes this type of treatment, sometimes, all the time, or at least a few times, avoid surgery?
Could you repeat your question? You kind of broke up.
When a person undergoes this treatment of manipulation on the knee, you said that it is not quite as well workable than with a shoulder, but can a person, because of it, avoid, or at least for a long time delay, surgery?
Yes, absolutely. But again, I would not call it manipulative. Let's call it manual therapy. Manual therapy is a term that includes all manual techniques. Yes, of course, pretty much the major goal and actually the purpose of my practice is surgery prevention. If you saw my logo on my website, you would understand we do everything possible to prevent surgery. Yes, of course, if patient has...
Are you referring to the guinea pig logo?
Exactly. We're not big friends of surgeons. I respect their profession, but in my estimate, 80 to 90% of all surgeries in the world are unnecessary.
There's information out there. I don't know how true that is, but I have heard that there's information out there that, especially these days, and maybe all the time, I don't know, but just for the fact of going in a hospital, you can walk away with a disease which is simply a lot worse than whatever they tried to fix via the surgery. What's that one thing called which people contract with just the slightest surgery sometimes in a hospital? What is it? I forgot the name of it. Those names they don't sit well with me.
You're probably talking about the infections.
Yeah, but there's a one specific one. which people seem to be getting a lot when they go into hospital.
I know exactly what you're talking about.
Or something like that?
Staphylococcus.
Staph infection, I guess they call it.
Yeah, Staphylococcus aureus, if I'm not mistaken. I'm not microbiologist, but I know exactly what you're talking about. And once you get it, you can never get rid of it. Mm-hmm. Yeah, again, I treat hospitals and surgery facility and surgeons with the utmost respect. Their skills is the result of many years of training and so forth. But unfortunately, in my estimate, in at least musculoskeletal field, which I'm part of, right, 80 to 90% of all surgeries performed are not necessary. They're quite avoidable. And if the surgery was not that much needed, but it was successful, okay, let it go. Fine, I agree. But what if the surgery was not successful and patient stays with residual pain, or there are some problems remains that make you sometimes bring patient to the debilitating completely condition. Even in classification, let's say, of spinal problems, for example, in classification, there is such a thing as a failed vertebral surgery syndrome, which is totally separate area, and we have to talk about it completely as a separate issue. People going to vertebral surgery, to spinal surgery, it's just like going to Las Vegas. It's roulette. You're playing with a slot machine. You can win, you can lose. You never know what to expect.
You left a word out here. It's not called roulette. It's called Russian roulette. Sometimes I didn't want to be as mean. But unfortunately, you're right. It's a Russian roulette. And people going into surgery, and unfortunately, again, family physicians, I treat them with a huge respect. But physicians know that if the situation becomes relatively worse than average, that's it. Go to surgery. Patients come usually to me asking whether I have to go to surgery. That okay, you can go. Then if you want to play Russian roulette with your health and with your spine, it's my pleasure. I'll be happy to see the outcome. But returning to the matter of knee, it's pretty restorable. I mean, these conditions do not need to be approached with a knife immediately. And I think one of the good thing about it is, so what I'm getting here is that a person who is about